Hi guys, so I did my presentation on the CAGE questionnaire. So this questionnaire is a brief list of questions that are used to identify potential alcohol abuse in medical patients. So this assesses 4 different aspects of the patient's alcohol use as well as the role that alcohol plays within their life. So the questions are to be asked in regards to the person's whole life and not just in the recent past or in their current situation. So before we get into the questions themselves, we can look at the history of this test. So this was developed in 1970 by Dr. John A. Ewing, who was the founding director of the Bowles Center for Alcohol Studies. So he did a lot of research on alcoholism and how that's treated in the medical field. So he found that physicians frequently did not identify alcoholism in their patients when they were admitted to the hospital. So this can be problematic in a number of ways, in that the patients aren't pointed and they're not guided to the most appropriate resources to treat that problem. And even in addition to that, if they come in for something else and the doctor doesn't know that they have a problem with alcohol, they could be given different medications that could interact in harmful ways if the doctor isn't aware of that. So it is important that they're aware of when this is going on. And national research showed that 25 to 40% of hospital admissions and 10 to 20% of general outpatient visits are related to alcohol or drug addiction. So this is a pretty common problem that doctors have to deal with. So this questionnaire is designed to be completed as part of a medical history when a person is admitted to a hospital, or for us, this would be seen as the same as an intake assessment. So the significance of these questions are that they provide insight on the role that alcohol plays within the patient's life. So like I said before, drug and alcohol use is a common problem, but it's typically undiagnosed and not recognized by the doctors. So alcohol dependency needs to be recognized in order for healthcare professionals to help the patient receive the necessary care, and they can then be directed to counseling, support groups, or self-help programs to address alcohol use. But first, the doctors and mental health providers need to be aware that this is going on before they can direct them to those resources. So this is what the significance of this questionnaire was and what Dr. Ewing wanted it to do for doctors to appropriately assess when this is going on. So the 4 questions that are asked within this questionnaire are: have you ever felt you needed to cut down on your drinking? Have people annoyed you by criticizing your drinking? Have you ever felt guilty about drinking? Have you ever felt you needed a drink first thing in the morning to steady your nerves or to get rid of a hangover? So I'll go into these a little bit more, but that last question is typically seen as the most significant question and the one that carries the most weight because it shows whether there might be some physical symptoms and symptoms of withdrawal going on, so which might indicate that it might be a little bit more serious. So the CAGE questionnaire versus other alcohol use questions that are typically used in intake forms or medical history forms. So these questions emphasize the patient's behaviors instead of just the number of drinks. So oftentimes we're told to ask them just how many drinks do you have a day or a week, but that number can be difficult to interpret and understand just because different people have different understandings of what that number means and how much weight that carries. There's also differences between gender, what that means. So emphasizing the behavior can provide a lot more insight than just the number of drinks that the person is having. So they're more specific than a lot of those other questions used in intake assessments. And I also really liked that these questions incorporated how other people in the patient's life felt towards their alcohol use. So it included other people's perspectives, which I liked because I don't think a lot of other questions necessarily will ask about that. So I thought that provided a lot of insight. As far as the qualifications of the administrator of this questionnaire, there really aren't any. This can be self-administered or it can be done by any type of healthcare professional. This is utilized in a variety of healthcare settings, so psychologists and therapists and just medical doctors. It's commonly used by primary caregivers, but there's a whole range of people who use these questions. There is some variation in the scoring depending on the administrator of this questionnaire. Typically, 2 yes responses are considered indicative of alcohol dependency, but it kind of depends on who's giving it. A score of 2 to 3 yes responses typically indicates a high index of suspicion that there might be alcohol dependency, and a score of 4 is virtually diagnostic for alcoholism. For some examiners, 2 yes responses are considered positive for males and 1 yes for females, but I think generally from what I could find, the gender differences typically aren't seen as significant, and there's no difference depending on the gender. Like I said before, sometimes more weight is given to certain questions. The last question, the eye-opener question, is typically recognized as the most significant because it demonstrates symptoms of withdrawal, which could indicate that the drinking is a little more serious than if there are no symptoms of withdrawal. So this questionnaire does have some strengths to it. It removes the personal judgment from the examiner, and it presents very direct and straightforward questions. It's also very simple to administer and score, and it focuses on the behavioral effects of the alcohol use and not just the number of drinks per day and week. So it provides a little more insight, and like I said before, it also takes into account other people's feelings towards the person's alcohol use, and not just their own subjective opinion. It does have a high validity. It accurately identifies individuals with alcohol dependence issues about 93% of the time, so that is a pretty strong validity score for this questionnaire. A potential weakness of this could be a potential error from the administrator. So this questionnaire was designed to be given before any other questions about alcohol use are asked. So the validity decreases if it's asked after other questions about how many drinks they've had or family history or anything like that. So this is designed, and it should be given prior to any other questions are to be asked. And another potential weakness, which I guess isn't really a weakness of the questionnaire itself, but I think it's important to keep in mind, is that patients just could be in denial about their alcohol use, and they may not truthfully answer these questions. Because denial is a pretty common coping mechanism towards alcoholism, there may be a chance that they're just not going to be honest, they're not going to answer these questions truthfully. So I thought it was important just to keep that in mind when we're talking about this questionnaire. So for our conclusion, research demonstrates that alcoholism often goes undiagnosed and untreated when patients come into hospitals for different reasons, and doctors typically don't recognize when this is going on. So healthcare professionals should be educated on how to use the CAGE questionnaire as a quick and simple way to assess a patient's potential for alcohol abuse, so that they can know when this is going on and they can direct them to the appropriate resources. This test does have very high validity, and it proves to be an effective screening tool to recognize alcohol dependency in patients. So I think it's important that healthcare providers are aware of this and use this to identify those individuals. So there are my references, and thank you for listening.